Namaste. I'm Dr. Sachin Kulkarni and she's Dr. Sharayu Mohite. Both of us are reproductive medicine and IVF consultants working in Pune. Today we are going to take you through this video on who all require IVF. So Dr. Sharayu, in your opinion, when you commonly suggest IVF for your infertility couples?
Yeah, in our routine practice, when the client is having both tubes which are blocked, those who are having advanced maternal age, most of the time more than 35 years of age, with low ovarian reserve, patients who are suffering from endometriosis, where low ovarian reserve is most common condition, and patients who are having premature menopause, where they have stopped their menses before age of 40 years. In those patients, most commonly we are suggesting IVF, and patients who are having severe polycystic ovarian syndrome, where the small procedures and small stimulations are not helping them. So in those patients we are suggesting.
Yeah, and sometimes even those women who are suffering from unexplained infertility, in a couple we don't know a reason and then they undergo multiple IUI cycles instead of 3 or 4 IUI cycles, and if they don't conceive, probably many times we advise IVF. And I think there is also from the male factor, when the sperm analysis is done and sperm count is very, very low, let's say consistently the sperm analysis saying it is less than 5 million, or even azoospermia for that matter, when we can take a testicular aspiration of the sperm and they need not go for a donor sperm, but they can have their own baby with a testicular aspiration. Well, I think these are the common reasons, but rarely we do advise IVF. Remember, for somebody who has a severe sexual dysfunction, don't you think so?
Yes, and it's very common. The incidence is on the rise since last decade. So many times it's very difficult and proactively for the client to have this history proactively. So in those couples, most of the time, we are now since last 2 years, it's been on the rise that for sexual dysfunction we are advising to go for IVF.
Yeah, and sometimes we get a couple who's been trying for 6 years, like an unexplained infertility. We don't know the reason, and they are in a hurry because of social reasons or family reasons to have a pregnancy. And since we understand that IVF has the highest pregnancy rate, and we'll end up going ahead and doing IVF for them as well. Well, these are the common reasons for which we do IVF, and if you want to get back to us for any appointments or any further discussions, you're most welcome to connect to us on following numbers and email us any of your queries. Thank you so much.
Thank you.